Hello everyone, welcome to mbbcheese.com. So in this video we are going to differentiate between T1, T2 and Flair MRI because in your exam this is the important part which is asked. Many of the students are confused between these three MRIs. So first of all we should know about the normal anatomy of the brain. So this depends on the three parts of the brain, which is first of all is gray matter, second is white matter, and third one is CSF. So from these three parts you can differentiate T1, T2 and Flair MRI. So how to remember these parts? So as you can see, this white matter contains the letter I. So I means inside. So anything inside the gray matter is the white matter. And you can remember this gray matter as, you can write G as this, you can cover this as this, complete the circle, and this is outside. And now coming to the MRI. Now you can see all these three MRIs. Now you can see all these three MRIs on your screen. So this is T1, T2 and Flair. So first of all you should know how to differentiate between these. So gray is outside, white is inside, and there is CSF. So first of all, first mnemonic is for T2. So T2, you can remember this, water is white. Water is white in T2. So CSF is white. Now coming to T1. First of all, you should differentiate between T1 and T2. So you can differentiate. There is CSF is black. In Flair, CSF is also black, but in T2, the water is white. So the CSF is white. So you have ruled out T2. Now coming to T1 and Flair. As you know, the gray matter is outside and white matter is inside. So you can see in this image, this I am marking this part. You can differentiate between the colors of these two. This is hyper intense, so this is white, this is hypo intense, this is gray. Okay, so the gray is outside and white is inside. This is T1. T1 looks like the normal anatomy of the brain as we have discussed before. So gray is outside and white is inside, and water is black in T1. Now coming to Flair. Just differentiate this part. This is hyperintense and inside is hypointense. So the hypointense part is gray part, this is white part. So the anatomy is reversed in this. So anything opposite to T1 is Flair, but the CSF is same in both these two. CSF is black and T1 in Flair. Now coming to the T2 part. So CSF, as we have differentiated this CSF, now we should look this part also. So the inside part is hypointense, so this is gray, and the outside part is hyperintense, this is white. So this is also opposite to T1. This is completely opposite. Okay, so the CSF is white matter is outside in this, and gray matter is inside in this. Only which looks like the normal anatomy is T1. T1 is always looks like normal anatomy. Okay, the first person is always normal, another are. Can you find out which type of MRI is this? First of all, look at the CSF part. So the CSF is here, CSF is white. So this is only T2. Okay, and you can also look at this part also. This is hyper intense, so this is white, this is gray, this is opposite to the normal anatomy. Okay, so this is the only T2 MRI. Now look at the CSF. CSF is black in this, so it can be Flair or T1. Okay, now look at this part also. This is hypo intense, so this is gray, inside is white. Okay, so this is T1 MRI. Now you can differentiate between T1 and T2. Now coming to another MRI. Can you find out which type of MRI is this? First of all, look at CSF. This is black, so it can be T1 or T1 or Flair. Okay, now look at the gray matter and white matter. Look at this part. This is the outside part is hyper intense, so this is white. Inside part is hypo intense, so this is gray. This is opposite to the normal anatomy, so this is Flair. Now you can differentiate all these three. So if you like this video, please give a thumbs up and share this video with your friends, and keep watching, keep subscribing.